There you are. Okay. So I'm Amanda Villavesas. Thank you all for coming today. We are going to be speaking with Zach Crouch and Keats Komisar of Landmark Recovery and the Bridge to Wellness programs. And we'll be talking today about basically substance use in the pandemic and how we can help ourselves stay healthy during this time and how we can take care of our bodies and really find healthy coping mechanisms at this time. So welcome, both of you. Thank you for joining us.
Thanks for having
me. Let people know a little bit more about you all. So Zach is an MFT and is the National Business Development Manager and former administrator of Landmark Recovery of Louisville. And he's committed to helping both the addict and the family system seeking recovery. At Landmark, their team understands that the individual and family must be involved from day one on a group treatment and individual treatment level. His educational background includes a master's in marriage and family therapy from Louisville Presbyterian Theological Seminary. He has worked with addiction in multiple capacities, including as a therapist for adolescents, adults, couples, and families with an intensive, outpatient program, as well as an operator of an acute medical detoxification unit at Norton Hospital. Currently, he oversees the business development operations of Landmark Recovery of Louisville. And Landmark, if you don't know, is a 45 to 60-day residential program for recovering addicts and their families. And Zach says his passion springs from being a person of his own recovery process for over 13 years. So thank you, Zach, for joining us today and bringing your knowledge and wisdom.
Happy to be here, Amanda. Thanks for having me.
And Keats is the Director of Marketing and Business Development at the Bridge to Recovery program. The Bridge to Recovery is a transformational residential program which specializes in healing individuals by addressing the core causes of anxiety, depression, and compulsive behaviors. The result is an emotional recovery and a renewed enthusiasm for life, which sounds fabulous. So thank you, Keats. Thank you for joining us today.
Thank you very much.
So I'm going to hand it over to the two of you and let you all have a conversation about substance use during these times. And then if we have any questions at the end, I will pop back on and let you know, or you might even read them and you can go ahead and answer them yourself. All right?
Sounds good.
All right. Thank you.
So, we're happy to be here. Keats and I are both happy to be here, to share our experience with you all. Share kind of what's going on in our respective facilities, but also kind of in the field, what we're seeing as well as a whole, especially during this pandemic. So what we've done for you guys is kind of created sort of like an interviewee process where Keats is going to ask me some pertinent questions as it relates to kind of areas in my field of expertise, which is dealing directly with, the patient, the family, dealing with people who are trying to get into the recovery process, right? So with that being said, I will then turn it over to Keats, and I'm going to ask him some pertinent questions, especially as it relates to kind of his area of expertise and what they do at the Bridge to Recovery. So, with that being said, I think that what we'll do, best thing to do, because we are on a kind of a tight timeline, and I want to allow you guys some opportunity to ask questions. If you have them, please do, is to turn it over to Keats, because I know you've got some good questions for me, man.
Well, thanks, Zach. And, I just want to add that Zach and I have known each other for probably close to a decade, I guess, now, and have worked on a lot of different things together, a lot of different functions together. So I've come to both know and respect Zach and, his passion for this type of business and his passion for really trying to help people really kind of start to recover and start to heal. So thank you for the work that you do, Zach, and thank you for believing in what we do. So that being said, so during the pandemic, mental health has been a big concern. From social distancing to massive layoffs, the concern is that many may be using drugs and alcohol as a coping mechanism during this unprecedented time. Have you seen an increase in people seeking treatment for drug or excessive alcohol consumption?
Right. So one of the things I want to highlight is the consumption of alcohol. So let's talk about drinking. Okay. So in Landmark, right, we have 3 facilities in 3 different states. So we're in Kentucky, Indiana, and Oklahoma. And I'll speak to the local facility here, right, in Louisville. We've seen an increase by roughly thereabouts about 15%. Okay, from this time last year to this year. And especially during this pandemic. So there's been a 15% increase in the number of people who have come into our facility, right? So that's pretty outstanding in the sense that that's a huge increase, right? And it's been sustained during this time. So beginning middle of March till now, our facility here in Louisville, which is about 64 beds. It's been pretty close to capacity, okay? So one of the things I look at, and what I've heard from our clinical team, is that there's simply more time, right, at the house, okay? And there's more people now sort of normalizing, if you will, the use of drinking. And I think that there's sort of a false impression that people have, like, right? So we're at home where, the kids might be asleep. Let's crack open a bottle of wine, right? And that turns into, as with any consumption of alcohol, the more you drink, the more tolerance you get. That can easily turn into a daily thing where, you're instead of maybe 1 bottle of wine a week that would stretch out, 3 or 5 days, you're finding yourself going through a bottle every couple of days now. And then it turns into a bottle every night. And then, well, what do you know? You're buying cases of bottles, right? You're going to Sam's Club or Costco, and you're buying in bulk at that point, right? So I think, from what I can gather, at least from our clinical team, and their feedback to me has been that there kind of is a sense of safety, a false impression that people have. Well, we're at home now, and there's nothing else to do. And that can lead into some outcomes that people find themselves in unfavorable circumstances.
Thank you, Zach. What about what about people that are already in recovery? Have you seen an increase in relapse?
That's a really good question. And what I would say to that is it's always challenging, especially I would say in the first couple of years to obtain that level of sobriety, especially with some of the harder substances that are out there. You think of opioids, you think of cocaine, you think of amphetamines. Amphetamines are really rampant right now in our community. How I would answer that is that it really, for those that are already in recovery, it really depends on their program, right, and what they're doing, right. So if you're a person that is sort of religiously attending meetings, and you've been going to meetings even during this pandemic, and you're finding that you're getting something out of it, you're meeting with your sponsor, maybe even virtually, you're going through this traditional AA or 12-step programming would have it, you're going through the steps, right? So you're really addressing some of the things that are there, some of the behaviors that are really there that lead back into the cycle of addiction, and you're really getting on top of that. The data is really kind of still forthcoming on how this pandemic is going to affect those with substance use disorder, because we're still pretty early on in it. But I would answer that by saying, what has been your recovery program like up to this point? If it's been a little shaky, you go to a meeting every once in a while, you don't really call anybody, then I would say that you're going to be at higher risk.
Thank you, Zach. Are you seeing people listing isolation or losing a job due to the pandemic as a trigger for their new addiction or relapse? Is this a significant portion of your overall patient base?
As people at home can probably relate, the isolation factor is really big right now. So yes, we are seeing more people coming in due to that, right? Even me, I'm a professional. I've been in this recovery process a long time. And I can say that it's that the landscape of recovery support groups, so that's, SMART recovery, that's 12-step recovery, that's refuge recovery. The dynamics of that have changed exponentially. So what I mean by that specifically is that your in-person meetings, right? Those just don't happen as much anymore, okay? Because people are scared, people are worried that, if we meet in person, then there's a chance that I will contract this virus. And the other piece of that, because I think there's some validity to it as well, is that, especially for people who are early on in the recovery process, meaning they have, a week, a couple months, is that usually those people have not been taking good care of themselves, right? So they're coming into a meeting, if it's in person, and you don't really know, and they don't really know maybe what they have, right? So, their personal health has probably been compromised because, maybe they've been around people who have had it. And when you're in the middle of an addiction process, you're really not thinking too much rationally about, am I going to get infected? Am I going to infect other people? Do these people who are around me have it? So I think that that's something that, has some valid, concerns, for people. The other piece to your question, the isolation factor at least, is even with people who are not maybe directly part of your support group, right? What I mean by that is like your recovery support group, is that there's not as many opportunities for family members, close friends, other support group members, just to do a check-in with you in person, right? And I believe it's much easier to hide behind, if you will. What I mean by that is a text message, an email, a voicemail, sort of where they are, right? You can kind of see, if you meet someone in person, their body language says a lot. Their tone of voice is going to say a lot about how they're doing. And as you all know, and I think, Brene Brown's work has spoke to this tremendously, is that, shame is such a critical piece, for people, especially I think in an addiction process, their ability to engage and help, right? Think about it. So there's a tremendous amount of acting out behaviors that go along with, being involved in an addiction process. So, sometimes it's spending hundreds, sometimes it's spending thousands of dollars, to maintain a habit, right? So I have a really dear friend of mine, and this happened 5-10 years ago, okay, when he decided that, Billy had had enough. He was buying opioids off the street, and, he was literally spending, I want to say, $1,000 a month, okay, on his pill habit, right? But he knew that I was in the recovery process, and it was a big thing for me to take him to meetings, to introduce him to people, to really help him get engaged in person in the fellowship of recovery, right? And that just can't happen right now. So I think that, it's had a big effect on people getting started in the recovery process.
Thank you, Zach. Yeah, I mean, that makes so much sense to me, that especially in that early recovery, connection, intimate connection is really vital, especially at the beginning. So are you seeing more people seeking help for themselves, or are you seeing more family members reaching out? What is that looking like at Landmark?
Yeah, that's a really good question. I think the answer to that is kind of both and, but also employers, right, are also seeing more employees struggling right now. So when you think of some of the larger employers, in our community, especially those jobs when the employee must be present at the workplace, there's longer hours that are being, people are having to work, right? So that naturally will increase the amount of stress and anxiety. The other piece of this too, when you think of that, is that if you're working longer hours and God forbid you're a single parent trying to do this, you likely still have, if you have kids, you're struggling with this whole at-home learning piece that people are having to maneuver. Okay, so that's presenting another challenge too. So I would say for a subset of, just as we're talking about the employees, the workers, that has led to the increased stress and anxiety. That's certainly increased to a higher level of use. I think with family members, I think that family members are probably seeing or maybe uncovering a problem. We'll talk about alcoholism, that's probably been present but gone unnoticed for maybe months or possibly years. Okay, if you travel a lot, which travel in a lot of businesses now has pretty much gone kaput. It's not happening. A lot of those individuals were maybe able to hide it, when they were on the road or, whatever it looked like. So I think that family members are maybe starting to see for the first time what's already been there. I will speak to folks who know maybe that they've had a problem or suspected that they've had a problem. I honestly will say that the pandemic for them, it can be a blessing. Okay. And by that, what I mean is that a lot of these folks, for the first time, perhaps, maybe they've been furloughed, right? They are able to address, maybe it's a mental health issue or a substance abuse issue. It's always been there. And perhaps they thought that they didn't have the time to do this, right? Now is an excellent time, right? And they, I think, are taking advantage of that. So, the wonderful thing I think about going to treatment is that if you go to treatment, even not during the pandemic, you are protected by federal mandates that would say that you can take a leave of absence, right? So I think that that's something that that people need to understand, is that by law, your job is protected. Okay. Now there might be a certain amount of time that you've had to been there, before you qualify. I think it might be 9 days before you qualify for FMLA. But, I want people to understand that and realize that there's really should never be a time that if you are struggling with a substance use problem, now is the time to go and seek help, because you don't have to live through that alone.
Thank you, Zach. This pandemic has changed, everything in our daily lives. And there's so many businesses, self-employed people, all types of people that have either lost their jobs or had to close their doors.
Right.
Are treatment centers open today for residential treatment? If I wanted to go to treatment, can I pick up the phone and be at Landmark this afternoon?
You absolutely could. And what we've done to ensure people's safety as it relates to where I'm at Landmark, and I'm sure other treatment facilities are following suit in some respect or another, is that we have a quarantine unit, right? And what we do is we test every patient that comes through into our facility for treatment. And they are, they're on that unit until we get the results back from the testing company that we use. And I think it provides a sense of safety for people that, they're not going to contract this when they come into our facilities, right? So that's what we've done, and it seems to be working really well. And I think the family members and patients have appreciated that. So unfortunately, one of the things that we've had to do is we're going to be bringing it back hopefully by the end of the year, or maybe even November, is at Landmark. I was trained as a marriage and family therapist. It was inundated to me when I went through my internship that unless you do treat the family members, your chances of having success with that patient long-term or even short-term are going to be severely compromised. So we have an entire family day of programming for just the family members and the patients that participate together. And it's typically when it's not a pandemic, from 9 in the morning until 4 in the afternoon. And that's an opportunity for the family to participate in everything from a psychoeducational group to a family process group. They sit in on a smart recovery meeting. They have lunch and visitation together. And we do what's called a need-to-need process. So, if, as an example, if Keats was my dad, I'm not saying you are, Keats, but if you were, it's an opportunity where Keats and I are literally on the floor sitting knee to knee, and one of our clinicians is leading a process where Keats has the opportunity as the father to say, Zach, I love you, but this is how your addiction affected me, okay, and my family, our family, okay, and often it's the first time that family members really truly get an opportunity to talk through and almost give witness to what's gone on in their life from their purview, how it's affected them. And it's a very constructive process where there's a tremendous amount of healing that can happen during that time. Because I think at the end of the day, the patient then really does know the lie that they've probably told themselves, like, I'm not hurting anybody but myself here. Everything's all good. That's the farthest thing from the truth. And, it's not about bringing shame to the patient or the family member, but it's really about increasing their awareness of how this truly is a systemic issue, right?
Right. Thanks, Zach. So how has the pandemic shaped and molded your outpatient care, and are clients in and outpatient, are they having in-person recovery meetings? What's that look like for you guys?
Yeah. So, as it relates to the intensive outpatient program that we run, all of the sessions right now are being run virtually. Okay. So attendance is good for the most part, but it's hard to say right now since it's still really early on, at least in terms of the data, what the success rates are going to look like for people who have completed all legs of treatment, including intensive outpatient program, during this pandemic, right? I want to go back to, again, the recovery support groups as well, the in-person 12-step meetings. So Dr. Nora Volkoff, she's the National Institute on Drug and Alcohol director. And she brought up a really interesting point, and it's very true in that, we're social creatures, okay? Social support systems are really, they're fundamental to getting started in this recovery process. And I think even more than that, people who have, even a guy like myself, I would say long-term recovery, 5+ years, anybody who has that, I would say is in that camp. They do need that support and I think even from the standpoint of nobody's lived through a pandemic before, okay? But, I think the challenge with, the recovery meetings, AA, NA, Smart Recovery, is that many of the folks are meeting exclusively through Zoom. The face-to-face meetings are so important for people, especially in the early recovery process, that as a community, right, not just people in the recovery process, we're going to have to address some challenges. And, there's a lot of folks who are early on, weeks, months into it, that, they're not able to meet with their sponsor. They're kind of winging it in a way. And, there's at least in my home group, there's because churches, logistically, you can't meet in churches right now. There is an annex building at one of these churches that's being used right now because, we're in October and cold weather is right around the corner. So meeting outside, it happened a lot in the spring and the summer, is pretty soon just not going to be possible for people. So I think creativity and, sort of ingenuity, these are really important principles right now that we can certainly all practice. And I think that those recovery support groups they're just going to have to come up with ways to keep the meetings alive and engaging.
Thanks, Zach. Yeah, that's a great point. It's really a difficult time for everybody, but it's especially a difficult time for people whose really mental health their mental health is really dependent on that physical face-to-face, as you called it. And oftentimes it has deadly consequences. It really is a life and death struggle. So
it is.
Thank you.
So I'm gonna turn it over to my colleague, my buddy Keats.
You're not gonna call me Dad anymore?
I'm not gonna call you Dad, man. Nope, I'm not gonna go there. Although you might be old enough for that. So.
I am old enough, but that's a different story.
Along similar lines of the questions that you asked me, it is no mystery that social isolation can have a really big impact on mental health. How would you say this increased isolation and change in routine, especially, leads even to the development of unhealthy habits that can lead into an addiction?
Yeah, absolutely. There's a lot of different things that come up when people, for whatever reason, are isolating. One of those is that there's more time, and a lot of times when there's more time, it's not unusual for people who are struggling anyway. And I would just like to, bring up a point that really transcends its way through all of the questions and really through all the things that you spoke of. And many people may already know this, and some may not, but when you talk about the family members of substance abusers, or when you're talking about compulsive behaviors, people with maladapted coping mechanisms, really the family member or the non-substance abuser, all of their issues are exactly the same as the substance abuser. There's really no difference between the non-substance addicted person and the substance addicted person. The only difference is the physical consumption of alcohol or drugs, but the pain is the same, the suffering is the same, the solution is the same. It's all the same. So that being said, as I was started to say, when we have more time, I think it's commonplace to start to obsess about, have obsessive thoughts, shame and guilt kind of creep in. And yet there's no, as you've mentioned, in person, or there's no connection going on. And so now they have all these things that have kind of creeped in through the lack of time. And then you add on top of that the stress of maybe losing a job, or the stress of maybe losing income, or the stress of other people in your family starting to consume more alcohol and drugs. And then all of a sudden that starts to build in the family member, and they have nowhere to go with it.
You know, as you were talking, I was thinking too, Keats, about, I mean, most of us are at home a lot more, and you mentioned there's more time, and, you know, the internet. Okay. So the internet is a perfect portal, as you were kind of, I think, alluding to process addiction. So I'm thinking about, you know, gambling, you know, sex addiction, gaming, you know, there's more opportunity, I think, for folks to simply, I would say, maybe just check out.
Absolutely. You know, pornography, porn addiction, gambling, gaming, screen time, you know, as you can kind of put it in a general grouping of screen time. You know, people use those things the same way substance abusers use a substance, is because they're getting something out of it. There's a release. There's a chemical release. There's an emotional release. Doesn't matter if it's sex or food or vodka or heroin or whatever it is. That whole same chemical process is going on. People are using those things to change the way they feel. And they're doing that more in this time because there's more pain.
Got it. Thank you. You know, back to, you know, the social isolation piece, right, and how it impacts people who have already started the recovery process, say someone who's even 6 months sober at this point. What have you seen? How does it impact the person's recovery, you know, this isolation piece?
Yeah, I mean, it's you know, if anybody is more vulnerable, if there's any group that's more vulnerable by all the things that we've mentioned, the lack of connection, the lack of physical touch, the lack of you know, being in a community, in a group, it's newly recovering people, because they, you know, when just speaking personally myself, when I first got in recovery in 1989, so I mean, it was being able to go to a recovery meeting and being able to be amongst people that were going through the same situations that I was going through. I really, really needed that. I don't know that I could have pushed through had I not had that. So it's always vital to do those things, but it's especially vital if you're in that 6 month to a year window.
You know, just beyond the mental health of a person, you know, the COVID-19, the pandemic, has really had an impact on the family. If one person develops an addiction, tell us about what, you know, this is often, I think, a pretty synonymous term with addiction treatment, but what is the addicted family system, and what are the unique roles that are portrayed, you know, by the people in them?
Yeah, that's a great and complicated question all at the same time. You know, at the Bridge, one of the many things that we work on is to help our clients kind of unpack their childhood and young adulthood trauma, because what we're trying to get them to see is that who they are today, the choices that they make in life, the people that they choose to be in relationships with, it's all grounded in the environment they grew up in and the people that influenced them as children and young adults. And, you know, I don't think it's any great secret that wounded people are attracted to wounded people. You know, a healthy, mature, well-adapted person would not be attracted to a wounded alcoholic or drug addict or, whatever, gambler, the list goes on and on. But a wounded person would be attracted to a wounded person because that's what we know. We're attracted to the things we know. And so it sounds so simple when I say it, but it's when you're in the middle of it, it's really hard to understand that. And so the family, getting back to your original question, the family members, they're not really totally aware of this. And so they then turn their focus on the substance abuser. And so that for them is a release, because if I'm going to focus on you, Zach, the problem child, and I'm going to spend all my time and effort focusing on you, then guess what? I don't have to look at me.
Right.
So that for them is a maladaptive coping mechanism. That's a way for them not to have to deal with their own issues.
Yeah, as you were talking, I was thinking about, it's kind of a question, but would you say that people, they need to learn or almost relearn new ways of having relationships with people? And the second part of that question is, what would you say makes the relationships with family members, forming new ways of relating and interacting with those family members so challenging for people, especially if you're trying to get into the recovery process?
Well, I mean, I think that, I'm sorry, could you repeat the first part of that question?
Yeah, I think it's more of a, do you agree or disagree? But do you think that, as we were talking about, like the roles and that people have and that they've sort of adapted to, if you're the person who's the identified addict, or person who's acting out, do they need to learn or relearn new ways of having relationships just with people? Okay,
I got you. So I don't think they're going to relearn. I think they're going to learn, because they've really never learned that to begin with. I'll just use my own experience. I came from an alcoholic home. I came from a dysfunctional home with a lot of divorce and marriage, and no one ever really getting along in the house. So why am I surprised as an adult when I am mirroring the same things that I witnessed growing up? And so I don't really, as an adult, I never really learned what a real trusting, intimate relationship looked like. I had never seen an example of that. And so, but yet I was trying to have that, but I didn't know how. So I had to learn, I had to learn, so these are some important parts in a trusting and lasting relationship.
Got it.
The second part of that question again was what?
Yeah, so the second part is really just about, what would you say makes the relationships with family members, is you're learning this new way of having relationships just with people, but especially with family members. How come it's so challenging in that regard to begin to have new relationships with the family that you've been a part of for, your whole life?
Well, it's very challenging because you have years and sometimes decades of dysfunctional relationships. And so people may learn new behaviors, and they may learn new coping skills, and they may learn new boundaries, and they may start to learn about real intimacy and trust. But that doesn't mean they're going to be able to implement it on a 24/7 basis. And so there's always this process in every person who recovers. There's the, I'm doing good, I know I'm doing not, and I'm not, and I'm practicing my new learning mechanisms, and then I'm not. And then the other family member is also trying to recover, and their recovery is coming in and out, and they're, one day they're they're using their boundaries and they're using their words and they're telling them how they feel, and the next day they're not. So it's a constant kind of pull and tug, for a while. But I think if as you mentioned in when you were answering the questions, speaking about how vital it is for the family members to recover along with the substance abuser, because here in my 14 years I've worked in mental health and substance abuse, this is what I know to be true. Johnny gets sober and changes his life, and he comes home and he starts a program of recovery. Well, one of two things is going to happen. Mrs. Johnny or Mr. Johnny, whatever, Mr. Johnny's partner, whatever it may be, he or her is either going to start to recover, or the relationship is going to start to grow apart. That's just a fundamental truth that I've witnessed, because you're they're saying in recovery, you're either, it's been a while since I've heard it, but let me see if I can say it. You're either going forward or going backward, but you're never standing still. And that's true in an individual, and it's also true in a relationship. You're either progressing in that relationship, or you're going backwards in that relationship, but it's never the same. There's never a standstill.
I think you bring up a good point, because what I was thinking about is the family being so used to this person, we'll say Johnny, right, as you brought up, acting this way, okay, and the other family members, Miss Johnny, Mr. Johnny, is really kind of thrown off, right? So there's the equilibrium within the family system it's thrown off. So there's instability now. The family members are probably unconsciously asking the question, now it's like, well, we knew what Johnny was going to do every night. Now he's not doing it. So what do I do now?
Right.
So the roles, as you were mentioning, are really no longer working, right? And Johnny, believe it or not, and I've seen it happen, gets sober, and the family will often, unconsciously, of course, almost force the person back into that acting out.
Correct. Yeah.
Now, I want to be clear when I say that, okay, that there certainly is a role, okay, a huge role, if not the role, that the person acting out on, whether it's drinking, gambling, whatever kind of process that they're in, they obviously make the choice, to participate in that kind of behavior. But, when I was first doing counseling, it was not uncommon for, Johnny to come home, and Johnny had been literally to a 2-hour AA meeting. You drive there, drive back. It's an hour and a half long meeting. They come home, and as soon as Johnny walks in the front door, Mr. and Mrs. Johnny is literally sniffing the person. Okay.
Yeah.
How you doing? And it turns into this sort of dynamic where Johnny doesn't feel like anything that he can do is going to be trustworthy. Now, granted, there's a lot of healing and a lot of time that needs to take place before trust begins to be established again. But that being said, I think one of the downfalls of many treatment centers in our industry is that there's not a comprehensive family program that takes place that is so critical as we're talking about now to a person's long-term success in staying sober and in living into the recovery process.
Yeah. Just to kind of relate another way of relating to what we're talking about, another kind of fundamental truth in human behavior is that people do things because there's a payoff for them. Right. Everything that I do, I go to the grocery store, get in my car and I drive, and I go to the grocery store and I spend an hour and a half, and I do all this because I get to come home and eat those groceries. everything I do, every action that I take, there is some type of payoff for me.
Right.
And that really applies in this relationship too. To use your example, Johnny comes home from a meeting and the spouse or partner or whatever, is sniffing that person to see if they've been drinking. So see, they're getting a payoff for that. That's a learned behavior that has gotten them a designated result in the past. And so another fundamental truth that I love to quote is that people do things because they can, because it's worked for them in the past. And so this difficult time you're referring to is the realization that, oh, this behavior doesn't work anymore. I'm going to have to find some other way to get my needs met, which is yet again another fundamental human behavior is that when we don't get our needs met, whatever those needs are, that is then starts a process of unhealthy behavior. I'm not getting my needs met, whatever those are. Maybe it's, I'm isolated and I'm not getting human connection. I'm not getting my needs met. So now I'm going to look for something else that's going to temporarily get my needs met. And so coming to the bridge or getting it or going to therapy or, you don't have to come to the bridge to get this kind of stuff. It's nice if you do, but you don't have to. There's a half a dozen different ways. But at the end of the day, simple things like learning how to get our needs met, learning that old behavior doesn't work, when people change. All these kind of things that we've been talking about are, if we're going to be able to heal, we're going to have to we're going to have to find a way to do that.
I want to be mindful of the time because I know that we're getting close, but this kind of leads into my next question, my comment in that, it's often been said, and quite a bit of research will point this out, that, addiction, process addiction, substance addiction, a lot of that is rooted in both a failure to attach in a healthy way, whether it's parents, loved ones, but also trauma. And I want to ask you the question, what does it mean when someone says, that alcoholism runs in the family? What I mean by that, is it truly a genetic trait, or is it linked to trauma that's maybe been experienced by having, as an example, a parent struggling with an addiction?
Well, Zach, maybe ask me that again in a 500 years, because we'll still be trying to answer that question. So I don't know. I don't know the answer to that question. I can give you my personal opinion, having spent the last 59 years dealing with substance abuse and the aftermath and all that. And that is, I definitely think that somewhere in there is there's a genetic piece to this. I hands down believe that's true, but I really feel like the lion's share of substance abuse or any type of compulsive behavior is grounded in family of origin trauma work, in family of origin trauma. And again, trauma is one of those words that gets thrown around a lot. Many people really don't understand its meaning, but another word that I've used before that I like to use is woundedness. That's really, anytime I suffer a wound, that's a trauma to me. I'm injured, right? I'm injured in my soul. I'm injured in my mind. And a lot of times I think human nature, again, I'm speaking a lot about human nature because it's we're all humans, right? So I think human nature is to dispel that and kind of blow it off and kind of minimize it, And truth is that it shapes and molds who we are, and it's who we become. We're a product of our traumas.
Do you think that people always realize, though, that they've experienced, in some sense of the word, trauma?
No, that's exactly what I'm saying. I think that, when they feel a wound, I think it's, the first thing you want to do is just forget about it, push it away, and I don't think that they've even identify it really as a trauma. And a great example of that is living in an alcoholic home. I can remember being asked that myself when somebody says to me, well, have you ever experienced any trauma? And my answer, I don't know, it's been a long time since they asked me this question, but my answer was something to the effect of, oh no, my parents loved me very much. I was never molested as a child and no one ever beat me, right? And so those were my definitions of trauma. If it wasn't those two things, then I didn't have trauma. But the truth is I grew up in an alcoholic home. I had suffered all kinds of what I've now come to understand is real trauma. But no, I never saw that. Never thought about it as being a traumatic experience.
I guess the last question would be, do you think treating past trauma is, critical to treating an addiction, even if it occurred, maybe like years ago in the past?
Oh, absolutely. Absolutely. Because remember, we do things as humans, but if I'm not getting my needs met, again, it all goes back to this, right? If I'm not getting my needs met, if I'm in some type of emotional pain, I'm going to reach out to something to make myself feel better. So what happens is, Johnny gets sober and he does really well. And he's going to meetings and he's doing all the things and he starts to feel better. And 3, 4, 5, 6 years go by. And all of a sudden, Johnny's doing porn, or, Johnny's having a serial affair, or Johnny's a workaholic, or he's intimate avoidant. All he's done is transfer that compulsive behavior because the trauma wound is still there. The substances are gone. That's right. Old coping mechanism. But again, like the marriage, one or two things is going to happen. Either Johnny's going to find another unhealthy coping mechanism, or Johnny's going to find a healthy coping mechanism. But there is no option C, because he's going to have to do one or the other. And that's true. That's true for myself. That's true. That's been my experience in 30-something years of being in recovery. That has been true 100% of the time.
Good stuff. Well, I think, we're about, 5-7 minutes or so before the end of our time. Amanda, I was going to open it up for questions. If people have any questions on the chat, or if you guys have questions, just on anything that we presented, or just anything in general, we'll happy to answer any questions.
Yeah, thank you both so much for this conversation. I think it's probably important, not just right now, but across our lifespan, right? Because what you're talking about isn't particularly, it's not something that only happens in these times. They happen, as you said, like most of us have not lived through a pandemic, so it's a fairly new experience. But at the same time, a lot of these things are things that people can experience at any time in their life. And I'm happy to hear, you mentioned Keats too, the idea that how people frame this concept of trauma, because trauma doesn't have to be this big event or this thing that happened to you, as much as certain things that we cope with in life every day, little traumas that build up over time, stress from work, and just inability to cope with it, right? So one quick question I would ask is, in some parting words as far as people who might be struggling right now, or thinking about drinking, or maybe working on trying to stay sober, any few last words for people like that who are experiencing, the stress of the pandemic in general and how they might be able to cope?
I'll say that, as I mentioned earlier, I think that shame is the driver and stress and anxiety are the drivers of many addictions, right? So, running by, someone that you trust that isn't going to just sort of say you're okay or you're all right. Maybe that's a priest, maybe it's your spouse or partner, having the conversation just about, hey, look, I've been under a lot of stress at work, and I've just noticed that my consumption, as we're talking about alcohol today a lot, has started to pick up. I think that that's a great place to start. If you don't have that in your life, then get into some counseling, right? If you really do think that you have a problem, you can call me, and I'm happy to just talk over the phone with you about maybe options that you haven't thought of at that point. Not everybody needs treatment, right? But I think it's smarter, in my last words to you would be, it's a lot smarter to act more quickly than to just sort of stave something off in hopes that it'll just get better.
Yeah, and I guess, I would definitely echo what Zach has said. And I think real quickly, I will say in my personal experience, that pain is the greatest motivator, right? Again, I do things because I have there's something that I want, right? And so when I'm in enough pain, I'm going to do something about it. And I do think that as difficult as it can be, reaching out, and I too, I've spent the last 8 years at the Bridge to Recovery traveling the whole country and connecting with therapists in all sorts of communities. And I too am able to talk to family members, or maybe you're sober and miserable, as we've talked about, to, either help that person get a therapist, or help that person come to the Bridge, or help that person get to maybe a facility nearer to them, whatever that is, I'm happy to do as well.
Can you all tell us, as we're signing off here, where can people find you, and how can they get in touch with you if they do have any follow-up questions?
Sure. Keats, you want to go ahead first?
Sure. So I would say that our website is thebridgetorecovery.com.
Mm-hmm.
And there's a staff page. There's a link that says staff, and there's a link that says corporate staff. And on that corporate staff page, you'll find my bio, as well as my email address and my phone number. So that's probably the easiest way to find me, is to go onto our website, look up under corporate staff members, and you can get my direct cell phone number and my email address.
Great, thank you. And Zach?
Yeah. So the one thing that I'll say is, I'll just put my information out there to the folks that are on the call. If you ever would like to just simply talk or consult on a case, whoever that is, whether it's a patient, I get lots of phone calls from family members, even therapists who have a personal friend or family member. My phone number is 502-905-1403. My email address is Zachary, ZACHARY.Crouch, that's CROUCH, at landmarkrecovery.com. And you can check out our website, like Keats has said, at landmarkrecovery.com. So www.landmarkrecovery.com.
Great. And do you want to plug your podcast too?
Oh, thank you. Thank you for that. We've got a podcast called Recovery Radio. and I host it just about every week. Have had some fantastic guests on there. Everybody from Lisa Najovitz, who created the Seeking Safety curriculum, to people that are in political positions even. So I had Senator McGarvey on the call once. He's our state minority leader, state minority leader in Frankfurt, and he had a lot of interesting things to say about the opioid crisis, the pandemic. So please, tune in. We'd love to have you.
Great. Thank you both so much. Have a wonderful day, and please get in touch with them if you have any questions. They are obviously very willing and available to help you out. So we appreciate that. Thank you all so much. Have a good one.
Thanks for having me.
Bye.